Thank you for coming again. Thank you. This is my second day in a row, but I'm very pleased to be able to say that there are no new cases of COVID-19 to report in New Zealand today. What I do want to do is provide you an update on some investigations that we've been undertaking with some other cases. So there are no new cases of COVID-19 to report today. That means our total number of confirmed cases of COVID-19 remains at 1,492, which is the number we report to the World Health Organization. There is no one in hospital with COVID-19 today. 10 previously reported cases are now considered to have recovered, bringing our total number of active cases to 43. Of those, 32 are imported cases in MIQ facilities and 11 are community cases. Yesterday, our laboratories processed 4,403 tests, bringing the total number of tests completed to date to 970,641. I note that while our case numbers are low, the pandemic continues overseas and is particularly active in many countries that New Zealanders are returning home from. As we will continue to see imported cases of COVID-19, it's timely to highlight our advice to New Zealanders currently overseas that there are some things they can do to reduce the risk of bringing COVID back with them. In the 14 days prior to departure, people about to return to New Zealand should consider avoiding going to parties, social gatherings or crowded places, avoiding contact with people who have COVID-19 or who have been in contact with cases, and staying home as much as possible to limit exposure to other people. Doing these things will help reduce the risk of being exposed to COVID-19, then bringing it home with you. People should also be aware of symptoms and get a test if any develop. I'd now like to update you on investigations into cases associated with returnees in a Christchurch isolation facility. This is a complicated story, so bear with me as I go through the details. The first case reported was on September the 19th. That person had arrived from Delhi on August the 27th and had completed 14 days in managed isolation in a facility in Christchurch and had returned 2 negative tests. That person then flew, along with others, from the managed isolation facility on a charter flight from Christchurch to Auckland on September the 11th, and we reported that case on September the 19th. While we cannot be conclusive, we now believe that this person was likely infected on that charter flight by a person seated behind them who had also completed 14 days of managed isolation and had returned 2 negative tests. That person did not have any symptoms, but tested positive for COVID-19 on September the 23rd as part of the contact tracing that we did for the charter plane. Extensive contact tracing has not revealed any other cases associated with that charter flight or any of the subsequent movements of these 2 cases other than their close household contacts. Investigations at the managed isolation facility show that the case, who was reported on September the 23rd, was likely exposed to COVID-19 near the end of their stay in managed isolation and was likely incubating the virus at the time of their day 12 test, which was negative. While we cannot be certain, our hypothesis is that the virus may have been transmitted to that person, the 23rd of September result, via the surface of a rubbish bin, which was used by another returnee who was likely infectious at the facility, and that was another case that was reported on the 9th of September. That returnee tested positive on day 12 of their stay in managed isolation, but they were likely infectious a few days before testing positive. They had tested negative on their day 3 test, and they were likely still incubating the virus. Public health officials and staff at the Christchurch facility have conducted an extensive investigation into all of these cases. That is included viewing CCTV footage, and a rubbish bin has been identified as a common factor. This is not dissimilar to the case at the Ridges in Auckland, where we believe a maintenance worker may have picked the virus up from pressing a button on a lift shortly after someone with COVID used it. It goes to show how tricky this virus can be, and that it can be transmitted via surfaces. The Ministry of Health has now updated its infection prevention and control guidance for all facilities, and all bins in public areas must be no-touch, and all rubbish must be securely sealed in plastic bags prior to disposal in the bins. In conjunction with the team at MB responsible for the management of managed facilities, we at the Ministry of Health are constantly working to improve on already very high standards of hygiene in our managed facilities. We do have a regular audit programme for infection prevention control for our managed isolation facilities, and we will continue to consider how managed isolation is managed with regard to the latest science and research around this disease. As soon as our initial reported case developed symptoms, they went and got a test, despite having tested negative twice in the previous 14 days. And they isolated themselves immediately and their household. These actions allowed us to quickly isolate, trace and test the contacts of the identified cases and prevented the virus from spreading further in our communities. And I just want to really thank and commend those individuals for their quick thinking. But it is a timely reminder to all of us to remain vigilant for COVID-19. Be aware of the symptoms, stay home if you're sick, seek advice about getting tested, and continue to record your movements using the COVID Tracer app. Thank you. Happy to take questions.
What's the time period between contact with the bin? Can you tell us that?
So we have a period of likely contact with the bin, which would have been around the 5th, 6th, 7th of September, that sort of period. That was the period just before the case that tested positive in the facility, the day 12 test. Their day 12 test was the 9th of September. So it was that period just beforehand when, as I say, they were probably infectious at that point. And then this other person who then had their day 12 test on the 9th tested negative. So was still would have been incubating, had been exposed but incubating.
But you don't know sort of, or the CCTV footage doesn't show like when that person had contact with the bin and then the subsequently infected person had contact with the bin?
The CCTV footage has been reviewed for that whole period. There are definitely periods during that period when they both had contact with the bin. And so that we can't be precise. It wasn't a one-off event. We can't be precise, but certainly we have evidence from the footage that the case who travelled on the plane certainly had touched the bin after the other case had touched the bin.
They were just both using the bin during that period multiple times.
Can you give some commentary as to whether the Ministry is satisfied with cleanliness and protection measures that are in place at these managed isolation facilities, given that we've now had the Ridges Hotel button on the elevator, and also now this case where there's been common touching of something in a common area? Yeah,
well, we certainly do have a high standard of infection prevention and control procedures in these facilities. These sorts of examples just reiterate how important it is to be completely vigilant all the time. So there are in this particular situation, bins are provided, bins are cleaned regularly, hand sanitizer is provided for people, and advice given that when they were using the bins to use the hand sanitizer before and after using the bins. It just re-emphasises how we need to be completely vigilant at all times, but we do have very high standards already in place, and these sorts of situations, what that triggers is us to go back and review our systems and just make sure that they are constantly the best that they can be, and that's what's happened in this situation.
Would you be looking to potentially bring in gloves and make, if someone is in a common area, so that potential is rubbed out? There's
a number of different ways in which the infection prevention can be prevented. It does involve using gloves. It's ensuring that we don't have common touch areas, regular cleaning of any places that are common touch areas. With the bins, what we've done as an additional step is actually not have bins that require you to touch in order to put the rubbish in. So that's an extra level of protection. But what we already had in place was regular cleaning of bins and the ability for hand sanitizer for people using the bins. So we've just taken it to that next level. Yes.
So the person that initially touched the bin, did they arrive later on than the person who later developed COVID?
No, they all arrived on the same flight. Which had come in from Delhi. But the person who tested positive on day 12, with that individual, from the genomic testing that we've done, and actually this is an example where the genomic testing has really allowed us to work out the transmission chains. What our hypothesis with that person is that they were likely infected on the plane from Delhi, which was why they didn't test. They were test negative on their day 3. They had been exposed on the flight. They were incubating. That's why we do a day 12 test. So they were picked up at day 12. That shows the system is working. But of course, they would have been infectious a few days beforehand. And then it's with the genomic testing that we've been able to link these cases to each other.
In your pre-departure advice to New Zealanders just earlier, you were saying that they shouldn't go to parties before coming to the country. That seems like very specific advice. Has there been any epidemiological work, maybe on those 12 cases, that would show that people were going to parties before they got onto planes to New Zealand?
No, that's just general sensible advice. You know, it's advice that we know how COVID is generally spread. It's becoming more and more clear that it's in these close gatherings, it's in more sort of social gatherings. So if you're in a country with already high levels of COVID-19, and many of those countries, as we know, have a number of restrictions in place already, so they probably shouldn't be at parties in some of those countries, but it does depend on which country you've come from. It's really based on that sensible advice. Think ahead if you are coming to New Zealand. It will help us if you minimise your exposure to COVID if you're in a country where there is a lot of COVID around. And most of the rest of the world has high rates of COVID.
Has there been any clarity on those 10 cases from yesterday, whether they came from the plane or whether they had it before their departure?
We haven't yet got the genomic sequencing from the cases yesterday. What I have been informed is that all of those cases yesterday are asymptomatic. So that suggests that they may well be historic cases. They certainly are not symptomatic, so that lessens the infectiousness of themselves.
What kind of interest has there been in downloading or ordering the COVID tracing booklet?
The booklet, I'm sorry, I don't have any details on that, but we can get back to you with that. I'll get the comms team to respond to that.
Can you say the bin was in like a common area, common touch area? Was it on site? Was it a public bin? And can you tell us if they needed to open it to put bin in it, rubbish in it, or if it was just...
So it was a bin in the facility. It was a bin in the corridor. So it wasn't a public bin for everyone in the facility. It was very specific for that floor. And my understanding is that there are a number of bins, and those bins are shared by some of the residents. The idea there is that the rooms are not being serviced by the hotel staff. So the people in the rooms are collecting the rubbish themselves and they put it in the bins. There's information and signage for them to use hand sanitizers before and after using the bins. This particular bin had a lid that required you to lift the lid. There was information that said use hand sanitizer before and after using the lid. The bins are regularly cleaned. So what we've done as the next step is we've said we shouldn't have bins with lids because it provides an extra opportunity for potential contamination.
Do you still consider it very rare for that sort of surface contamination?
I think what we're seeing more and more of is that surface contamination can be a cause of COVID transmission. I think we've got a couple of very specific examples now in New Zealand, and we're seeing that across the world. I think one of the luxuries that we do have in New Zealand is that we can do this sort of in-depth investigation because our numbers are so low, and we've now got access to genomic testing, and we can go into the details. We've got really good contact tracing, so we were able to immediately identify the close contacts, the casual contacts, assure ourselves that there had been no further spread. Many other countries aren't actually able to do that in-depth investigation, and as I say, our most likely hypothesis here is that this is surface transmission.
Are we talking about the isolation and testing rules for Aircrew that have just come out? Can you give us more details about what locations are considered high risk and what locations will be included in the weekly surveillance testing that's going to be happening from later this month?
I'm not able to give you those specific details, but we have worked with Air New Zealand to identify what those high-risk areas are. The high risk is a mixture of the level of disease in the country, where the layovers are, the length of time that a layover is happening. Some layovers, crew are not airside, they really just go and come back. So there's a number of different factors that have gone into that risk assessment.
But as you said before, most countries have a much higher rate of COVID than New Zealand does. So would it not be feasible just to have a blanket rule for everyone coming into the country in terms of isolation and testing?
There are particular, again, this is about the extent of the nature of the layover that the crew have in those countries, and that's where it's not just about the country itself, it's actually looking at all those other factors. Some of the staff are not spending any time in layover, they're really coming straight back. Others are spending a longer period of time. So like, for example, in LA, that is a longer period of layover, and LA would be a high-risk area. Oh. So those details, we can get you the specific details, but that will vary as the risk profiles of the countries vary, but it's not just about the country, it's actually about the nature of the stay.
Are we ready to have Australian visitors come to New Zealand, and what needs to change before we're ready to allow that?
Well, our current position is that everyone coming into New Zealand is required to go into quarantine and isolation facilities for the 14 days.
Can you clarify with this case that you talk about, the complicated story?
Yes.
Is either the people we're talking about the case that we have been thought of as being one that had a very long incubation time? So you're now saying the incubation time is not what it is, it's...
That's right. So when we reported him on the 19th of September, we were potentially looking at if that person had been infected before they came into New Zealand, it would have been 20 days, I think, as an incubation period, which would be unusual. What this investigation now leads us to believe that no, this was a person who was then infected on that charter flight from Christchurch. So we're no longer looking at a longer incubation period.
And then in terms of that, then has that changed, or will that change the way in which you're providing advice to the various relevant ministries? Because a lot of us in the country thought that long incubation was now something we really needed to worry about. How does that affect you guys operationally in terms of your advice?
Well, we're still providing that advice. We've reviewed the evidence around the maximum incubation period, and so we'll still be putting up that advice two ministers.
Has the
What are
ministry
the-
gotten any closer to establishing how the index case in the Auckland cluster contracted the virus, given that now there's sort of growing bodies of evidence that surface transmission is still a possibility? Is that a working hypothesis for you in that case as well?
We've never ruled that out, but with the index case in Auckland, the Americold case, we've never been able to demonstrate where the original source of infection came from.
Are you still currently working on trying to do that?
We still haven't. We haven't stopped. We've got no active leads at the moment, but we are still. Any new piece of information that we get, we're constantly reviewing against the movements that we know in those early days with the original cases that were notified to us. But we still haven't got a source. No.
What are the delays for getting into managed isolation here?
What do you mean by delays?
Are there any delays, sort of a time period before people get into managed isolation here at all?
Well, not when they come into the country from overseas. They're straight into managed isolation. Or any community cases, we're now recommending that they also be in managed isolation. There's no delays there. They're just speedily processed.
In terms of the managed isolation capacity, do you know how many aircrews, the numbers of aircrews that are going to need to go into managed isolation, and whether there's capacity for them?
My understanding is there is capacity. These are the international aircrews, so there's a smaller number because there's a smaller number of flights happening across the world, but the particular requirement to go into the managed isolation facilities for the international based aircrew, we've already seen that happening. What I reported yesterday from the flight yesterday, that Air India crew had already gone into managed isolation, so that will be managed as part of the process going forward.
Do you know roughly what the numbers are, though? Is it dozens a day, or just to get a sense of how many we're talking about?
It would be less than, well, maybe a dozen a day. Yeah.
Can you say why
Just some questions for a colleague. What were the ministry's plans to stress test the contact tracing system before this current outbreak?
We had been thinking about stress testing. Certainly that was in that period when we didn't have any cases, and we had been doing work looking at tightening the systems, and the best way of testing your tightening the systems is to do some sort of stress test. We then sadly didn't need to do an artificial stress test. We had the Auckland outbreak, which we're now reviewing the response to that. And once we've reviewed the response to that, I think we've seen a lot of really positives that have come out of the response to the Auckland outbreak. Once we've reviewed that, we will then look to see what further stress testing we would put in place.
Because there were calls for this to take place from as early as May, which was obviously 3 months before the August outbreak. Can you explain why that took so long to happen and didn't in fact happen in the end before the outbreak?
There had been a number of different aspects of the response as a whole that we wanted to stress test, and we wanted to, particularly for the contact tracing service, we wanted to make sure that that was all in place. And if you can recall, back then we rolled out the contact tracing service across our different public health units in a sequenced way, and we wanted to then stress test it when we had everybody online, so that then we could really benefit the most from doing the stress test. So that's just about the contact tracing.
And are there any plans for further stress testing now that there is kind of a lull in cases at the moment?
No specific plans just at the moment, but certainly we will be continuing to test our system. I mean, I think what we've seen with both the Auckland outbreak and also the response to this cluster is we've got a very good system at the moment. We have got fast and effective contact tracing. We've got very proactive isolation procedures happening. Our response has benefited from the first wave that we saw in New Zealand, and also benefited from what we've seen in other countries. More information about, for example, if you're asymptomatic, you can be infectious, and the possibility of surface transmission. So that means that we have changed some of our approaches. We've seen that in action with both the Auckland outbreak and then also this most recent cluster. But of course, there's always more that we can do better. And so, yes, we will continue to test the system for sure.
Can you walk us through the 48-hour rationale for the Kiwi Aircrew coming back from overseas from high-risk locations? Why only 48 hours? Some people might think that it should be a week or 2 weeks, or why only 48 hours?
The understanding there is that the layover that those individuals are doing in the high-risk countries, that they are effectively in quarantine during that period over there. So, and there's very strict requirements that we've put in place for crew to comply with those requirements. We have said that if there is any breach of those requirements, then crew will be required to have 14 days of isolation when they come back. But it's in recognition of actually what's happening over there, the extra assurance of them 48 hours when they come back, test negative, and then get back to work.
And can you say also how long it's been since the last time we had a case infected in the community, as opposed to like a close contact who was infected and who was in isolation when their case was reported?
So a unknown source community transmission.
Who had COVID in the community, like for example the nurse at the jet park, for example.
I'll get back to you on the specific details there, because I don't want to give you the wrong date and then that to be reported. But we, with the cases that we've got, the most recent community case that was reported was the 24th of September. But that was a case who was in isolation. That was a household contact. They were already being isolated. So it depends on specifically what you're asking. There's another measure that we do look at, which is the date of a unknown origin community case. And for us, that is back at the end of August. But I'll get you the specific date on that. That's genomically part of our Auckland outbreak, but wasn't epidemiologically linked. And so that's a key issue for us to look at.
In terms of testing, it's tracking downward basically daily and definitely weekly. Is the Ministry of Health concerned about that?
We want to keep the testing rates up. Testing is certainly one of our key pillars. What we've seen with all of our recent responses is the sooner you know about a case, the better. It allows you to then respond quickly, but also it limits any spread of that particular individual. So just like to reiterate, anyone with symptoms, please get tested. Please contact Healthline around getting tested. Find out the arrangements to be tested. If, as I said yesterday, if you're on holiday, that doesn't mean to say you can't get tested. We really want people to continue to get tested. It's important.
And just in terms of that, there was going to be targeted testing of transport, tourism and another workforce during the school holidays. How has that gone? Where has it been rolled out? What's happened? How many tests and so on?
Well, the details of what's happening in each of our district health boards is planned by the district health boards. Certainly that's my understanding, is that in our high tourism areas there's a significant amount of testing happening. And that's, as I said, it's one of our assurances that if there is any COVID out there in the community, that we'll be able to detect it.
Do the Aircrew
So, last couple of questions.
Do the Aircrew rules also apply in the same way to crews flying air freight, which is a significant part now of our flights coming into the country?
I think we're going to have to get back to you on that, because I think the rules are actually quite. It does depend on. It's not just flying the plane, it's about the stayover in those countries. So we'll get back to you, bearing in mind that that was just announced today.
What's the Ministry's advice to doctors who may be seeing cases of long COVID presenting?
In terms of what sort of advice?
Are they required to alert the Ministry? Have you got any advice to them about how to treat people who are with this?
So so I'm assuming your question is about people who we know have had COVID in the past, but they're continuing to
have
be
symptoms and
affected
relapses.
by that. And that's something that our clinical advisory groups are looking at, what sort of advice and support we can provide our clinicians for that. There's certainly been a lot recently of international literature about the fact that symptoms can persist, that people can have ongoing sequelae from COVID-19. That's not something that normally the Ministry of Health tells clinicians how to do things, but we're here to support clinicians through sharing the best evidence and best practice. So last question.
Some of the new aircrew requirements seem pretty basic, like the PPE, wearing of PPE in airports and on planes, for example. Have we just been too lax on aircrew requirements up until this point, and has that put New Zealand at an unnecessary risk?
No, we certainly haven't been lax with our requirements for Air New Zealand. We've had very frequent discussions with both Air New Zealand and also international crew since COVID began. What the air border order does is that puts it into an order. So some of those items that you've seen have already been in place. It's just that we haven't had a mechanism for requiring them or mandating them, but they've actually been, many of them have been in practice, and we've seen from the non-existence of cases from our crew. I actually cannot recall the last date of a flight crew who had COVID-19. It was certainly back in the first wave, and yet our air crews are continuing to fly. So we've already got really good standards in place. What this does is put it into an order. So I think if that's all right, I'll leave it there for today. Thank you very much. Thank you.